and welcome to the We Talk Health podcast, the official podcast of West Tennessee Healthcare. I'm your host, Kara Mobley, and on today's episode, I have with me Dr. Lindsay Foust. She is a podiatrist at Innovative Orthopedics in Paris, Tennessee. Welcome to the podcast, Dr. Foust.
Hi, thanks for having me.
Thank you. So I want to start off by talking a little bit about you. So just kind of share a little bit about your background and what led you to specialize in podiatry.
Well, I was born and raised in Henry County here in Tennessee, and I was always interested in becoming a physician of some sort. I went to Murray State University and was majoring in pre-medicine. And when it was my time to decide, I just honestly kind of fell into podiatry. I think it was definitely meant to be. I love my job.
Great, yeah. So my next question would be, what drew you to practice here in Paris, Tennessee? And, since you're native of Henry County, did you think about moving anywhere else, or were you always planning on staying here?
Well, my training for podiatry did take me away. We had to move to Ohio. I was there for several years, but
right.
Both me and my husband were from here in Henry County, so we always wanted to move back to raise our family and to do our careers.
Great, yeah. So what do you enjoy most about working with the patients in the Henry County community?
I love working with my patients in this community because it feels more like a family. There's kind of like a trust and a respect that I don't feel is always felt in a bigger city.
Right. And so, yeah, especially with Henry County being a small town, that the people that I've met, since West Tennessee Healthcare got involved with Henry County, that's one of the main things I've heard from the people I've interviewed is just the small town community feel.
Yes.
So in terms of podiatry, I have never interviewed a podiatrist before, and so this will be new to me as the host and for listeners, I'm sure. So in terms of foot and ankle health basics, why is foot health so important to overall wellness?
Well, foot health is so important because if you think about it, your feet are your foundation.
Right.
Your feet can reveal subtle changes due to bigger systemic issues going on, like diabetes and cardiac issues, and even heart failure.
Right. And I would imagine, if you take it for granted until you're having trouble walking or things like that.
That's exactly correct.
So what are some of the most common foot problems that you see in your practice?
If I had to pick the most common, it would probably be things like plantar fasciitis and tendinitis. I do a ton of ingrown toenail procedures.
Oh, okay.
Patients with arthritis and deformity, and we do a lot of wound care as well.
Yeah, plantar fasciitis. I'm pretty sure I have that. I also have flat feet, which I know having flat feet, that's your foot and your ankle, if it's twisted in, it can cause, I know I've heard a lot about how the foot can affect, your back, your knees, all kind of things.
Exactly right. It's your foundation. That's
right.
Exactly right.
So when should someone consider seeing a podiatrist instead of trying maybe home remedies?
Well, I'll be honest, I'm not a home remedies fan in general.
Right.
Like, I don't feel like home remedies are a good idea anyway. But especially anyone with significant comorbidities like diabetes or cardiac issues or other circulatory problems, you should always see your podiatrist immediately. Don't ever let anything kind of go unchecked.
Right. And so I have a follow-up question to that is, do you need a referral to be seen by you, by maybe a primary care, or how would people get in touch with you?
So people can schedule an appointment by just calling the office here in Paris. However, some insurances do require referrals for specialists. So it's really insurance dependent.
Okay. So I guess they could just call and ask.
Yes, they can, or they can talk to their primary care provider. And most of the time they can answer that question for them as well.
Sure. Right. So let's move on to some preventative care and tips in that arena there. So what advice do you have for people who spend long hours on their feet every day?
Well, many of my patients are factory workers or doing jobs that are very physically demanding. And I think probably the number one thing that I tell them is when it comes to shoe gear, you get what you pay for.
Right.
And good shoes, they will be pricier, but they are usually better made. They are usually way more supportive. And in the long run, you're going to be spending less money because you're not going to have to replace them as often.
You're not going through them as much.
That's correct.
I know I used to work at a scrub shop, so they had like the Dan skins and the Sanitas and the Allegras, and those, I have Sanitas, like they're the clogs.
Mm-hmm.
And as a flat-footed person, those really help. And I also
Yeah.
know, in those spaces, they're for nurses, they're for people who are always up on their feet. Do you have any recommendations on like compression socks or anything, or how you feel about those?
So I am a true advocate for compression. I wear compression socks every single day to work. I have no circulatory problems. They are preventative. However, they also help with fatigue.
Oh, yeah.
Like you wear compression during a work day and then compare it to not wearing compression during a work day, and I can almost guarantee you that your legs, ankles, and feet will feel better.
Right. And I have a sit-down job, and if I ever go on vacation or take a hike, by the end of the day, my ankles are so swollen just because it's like my body's not used to that. So that's
Yes,
when I'll be like, let me wear compression socks today to kind of help with
yes,
the
extremely
circulation.
important. That's right.
So I think we kind of answered that with, are there any other things that you would suggest to help people prevent foot and ankle issues as we age?
So if you ask any one of my patients, probably the most, I guess, advice that I always give patients is always stretch your muscles.
Hmm.
Stretch your hamstrings, stretch your calves, stretch your quads, make it part of your daily life, because I truly believe that stretching out all of those things and keeping that tension off of your foot and ankles
Right.
really helps reduce foot and ankle problems.
Right. Yeah. And I mean, you sleep once you wake up from sleep, you're all stiff and everything. So just things need to be kind of stretched out.
Yes.
Now, do you suggest any types of shoes? Like I know I mentioned some of the ones that I liked. Anything listeners should look for when choosing proper footwear?
So, proper footwear is always going to be more on the firm, supportive side,
Right. Yeah.
never ever on the soft and flimsy side.
Yeah.
Memory foam is not your friend. Everyone wants memory foam. It
Yes.
is not supportive enough and it is not good for your feet.
Anytime I see cushion, I'm like, I can't do that.
That's right. And a lot of people think that when their feet hurt, oh, I need to put cushion on it. I need to put something soft on it to make it feel better. When in actuality, you need
Yeah.
the exact opposite. I tell my patients, like, think of it as if you're bringing the floor up to your foot so that your foot doesn't have to work so hard.
Right. Yeah. I've never thought of it that way. And yeah, it's counterintuitive to like what you might think. Like, I need something soft for my aching feet. But it's like, no, it's the opposite of that.
That's correct.
So, what types of treatments and technologies do you offer for foot pain?
So I offer many conservative options. I mean, I am very into education. I try to
Hmm.
educate my patients a lot. I educate them on footwear. We offer prescriptions. We don't do custom orthotics in our office, but I do have a local orthotics place that I referred to.
Okay.
We do orders for formal physical therapy. I offer in office procedures like injections, ingrown toenail removals, skin and nail biopsies. And then, of course, I offer surgical reconstruction as well.
Great. Yeah. And so, how have advances in podiatry improved outcomes for patients that you've noticed?
So, podiatry has really come a long way, especially in probably the last 10 years. I think some of the most interesting advances lately are the minimal invasive procedures that they offer now.
Hmm.
I have done several trainings, and I'm in the process of incorporating that into my practice. But surgeries that used to require big, huge incisions and long follow up postoperative care are now being done minimally invasive,
Right.
and the recovery is a lot better. There's also specialized injections like platelet rich plasma that we can do that can aid in healing, aid in arthritic pain, aid in tendonitis. And then, from a wound care standpoint, which I also do a lot of, newer skin grafting techniques, new skin grafts are coming out on the market that are working very, very well.
Okay. And that would be more for like, I guess, diabetes patients.
Correct. My most common wound care patient is absolutely a diabetic. Not everybody, but most people are diabetics, yes.
Sure. And I'll say this for myself as someone who has to find shoes with a lot of arch support. I appreciate that over the years, footwear for arch and help with that have come a long way in terms of looks that you don't have to wear something
Yes,
that's like quote unquote ugly or a big
that's
bulky shoe.
correct.
So you can find like cute. There's more options now for cuter shoes for
That's
foot
correct. Yes.
support.
I try to always tell my patient because they'll look at me and I'm like, I promise you can get something that's stylish. It doesn't have to look
Right.
like a Herman Munster
Yeah,
shoe. I
you
promise.
don't have to like dread hearing that. It's like, oh no, they've
Yeah,
got a lot. It's come a long way, I think.
right. That's
Now,
correct.
do you have any success stories or anything that really sticks with you from any of your patients?
So I thought about this last night and I mean, I have numerous patients that are stuck in my head that I will always remember, but one in particular was an extremely nice gentleman. He presented actually to my wound care center with a chronic wound on his ankle. He suffers from severe rheumatoid arthritis,
Mm.
and essentially, his foot was completely turned inward. It was completely dislocated from his ankle. So he
Oh.
walked on his ankle bone
Mm.
and it caused him pain. And he was at the point where he literally just asked if he could have his leg removed. And I was like, well, let's not jump to that yet. Why don't we try this? So, me and a colleague were able to essentially reconstruct that and get his foot back up underneath his ankle. His wound healed. And now, I mean, he's walking pain free. So that one really sticks out in my head when he was just at his wit's end, ready for an amputation, and we prevented that.
Wow, yeah, that is a great story because it's like you were able to say, no, this doesn't have to be the way it goes.
Right, right.
So we touched on this a little bit about diabetes, but if we maybe wanted to go a little bit deeper into the diabetes side of it, how does foot care differ for people with diabetes?
So, foot care in patients with diabetes is extremely, extremely important. Diabetes is the number one cause of all non traumatic amputations of the lower
Mm. Oh,
extremities.
okay.
So, people who have diabetes are much, much more likely to require an amputation throughout their lifetime. Many of these amputations start out as a tiny little blister or even a tiny little corn on their toe, and that can progress extremely fast. Diabetes also can cause nail changes. So it's just extremely important that even if you're a well controlled diabetic, that you have a podiatrist that you see at least once a year.
Right. And this is an aside from me, knowing someone with type 1 diabetes who was just diagnosed with peripheral artery disease. Do you deal with any of that side of it?
Yes, I diagnose that all the time. Of course, I'm not a vascular surgeon, a vascular doctor, but just based on a foot and ankle exam, I can diagnose peripheral arterial disease and get the patient to the specialist that they need.
Okay, yeah. Because I know that's, surgery may be an option, but I know lifestyle changes help with that as well.
Right, and education, that is correct. That's a
Right.
good point. Education and, you know, I don't treat diabetes. I'm a podiatrist, but I can definitely stress the importance of tight glycemic control, keeping those blood sugars in control, taking your medication like you should, because it can definitely prevent a lot of problems.
Yeah, and that's something I've noticed in a lot of the interviews that I've done is that whoever I interview, whatever specialty they have, it's collaborative with, often, several other specialties working together to help the patient.
Oh, absolutely. That's absolutely true.
Right. So, do you have, what should athletes or weekend warriors keep in mind to avoid injuries?
So, just like I said before, always stretch before and after exercise. Stretching is so, so important. Stretching before and after will definitely decrease your risk of injuring yourself and getting stress fractures, etc. And I also talk to my weekend warrior runner, the people that run
Hmm.
several miles, but they only do it a few times a week. The problem is they forget to change their shoes out. So
Oh,
they're using
yeah.
the same pair of shoes for a year, and those shoes do break down. So it is so important to change your shoes out, buy new shoes, get the best shoe for your foot type. And then I also try to stress never ignore pain. Don't try to quote unquote push through the pain
Right.
because you can really hurt yourself.
Are there any unique challenges that you help seniors address with their feet?
Well, the seniors in this community, they suffer from skin changes and nail changes, as well as a lot of senior patients kind of lose the fat pad on the bottom of their foot, which
Mm.
leads to a whole other host of problems. They also have deformity, and I do feel like the senior population, they really need regular foot and ankle wellness checks.
Hmm.
They really need foot evaluations just to prevent problems.
Right. And I mean, I know for myself as a non-clinical medical person that podiatry is not something people think about quite as often when they think of, the medical field. So what do you wish more people understood about podiatry?
Well, I guess the main thing I want people to understand is, believe it or not, we do not just trim toenails. We are certified foot and ankle specialists and surgeons. We have intense training, 4 years of medical school and 3 years of podiatric surgical residency. We specialize in all things foot and ankle, and if I can't stress this enough, podiatry is a great specialty.
Right. And, even the name of your practice, Innovative Orthopedics, it's not just feet. Your feet affect so many other things.
That's correct.
So if someone was nervous about seeing a podiatrist, what would you say to help kind of ease their mind?
Well, I mean, I can't speak for everyone, but I can speak for myself and for my help that I have is most of us are extremely patient. We are kind. We are here to listen. We are here to help you. And most of the time, I feel as if my patients leave either, physically feeling better, or at least we have a clear plan to getting to feeling better.
Right, exactly. So we mentioned this at the top, but we can go into more detail on this, on how can listeners get in touch or schedule an appointment with you.
So potential patients can contact West Tennessee Health at Henry County Hospital. That's just a general number. I actually don't have that phone number.
I can, yeah, and I'll put that in the show notes as well, so that we can that people can see that there.
Or they can just directly call my office. It's Innovative Orthopedics at Kelly Clinic. Our phone number is area code 731-644-2271. And once again, just sometimes your insurance does require referrals, but if it doesn't, we can absolutely set you up with an appointment.
Great. And so just as we wrap up here, just to get to know you a little bit better, are there any things you enjoy doing outside of work? Any local spots or hobbies?
Well, I'm a mom. I have 3 kids, so that's very, very time consuming.
Yes.
I have a 12-year-old, a 9-year-old, and a 5-year-old. But we really love to travel. And I mean, we don't go to like exotic places, but just traveling. And we also love to camp. We do that on a regular basis.
Yeah.
So that's kind of what we do as hobbies.
Great. And if you could give one piece of foot health advice to everyone listening today, what would that be?
So I guess it would be listen to your feet and always look at your feet. Don't forget about them. They may reveal a lot of issues going on.
Right. And as you said earlier, they are your foundation.
That's correct.
Well, thank you, Dr. Foust, for coming on. And just as another note, Innovative Orthopedics, the phone number is 731-644-2271. And I'll include that information in the show notes, and also just the main Henry County Hospital number if anyone wants to call there for general information. And I just want to say thank you again for coming on and giving us a little bit of information. I know it certainly helped me learn a little bit more about podiatry and all that goes on with orthopedics and things like that.
Good. Thank you so much.
So yeah, I appreciate you coming on, and hope to talk to you soon. Maybe if you've got any new innovative things, we'd love to have you back.
All right. Thank you.
Thank you so much. Thank you for listening to We Talk Health. This podcast is not intended to replace any medical advice. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions or would like to request a topic, you can reach out to us at wetalkhealthpodcast@gmail.com.